what if, and just hear me out for a second, we could fight those nasty antibiotic-resistant bacteria with viruses?
That's actually not as crazy as it sounds. It's called phage therapy, and that's exactly what we're going to be diving into today.
All right, I like where this is going.
We're going to be looking at some cutting-edge research about using phages to combat Klebsiella pneumonia, a superbug you really don't want to mess with.
Yeah, I know a bit about Klebsiella, and it definitely sounds like something you want to avoid.
You've got that right. Klebsiella infections are becoming a serious threat because they're becoming resistant to most of our antibiotics.
And it's not just that they're resistant. They also like to make themselves at home in our bodies.
Exactly. They form these biofilms, which are like bacterial fortresses, and that makes them even harder to treat.
Okay, so we've got these superbugs building fortresses in our bodies, and our usual weapons are useless. What do we do?
That's where phage therapy comes in. Think of phages as little assassins, but instead of going after humans, they hunt down and kill specific bacteria.
So they're like smart bombs going after the bad guys only.
Exactly. Unlike antibiotics, which can wipe out both the good and the bad bacteria in our systems, phages are incredibly precise. They're programmed to target only the harmful bacteria, leaving your healthy cells alone.
That's amazing. So basically, we can send in these phage assassins to take out the Klebsiella without causing collateral damage.
You got it. Sounds like a perfect solution, right? But, like with most things in science, there's always a catch. Klebsiella bacteria have evolved these protective capsules that act like shields, making them resistant to phages.
So our bacterial bad guys have their own body armor. That's not good.
You're telling me. But nature, as it always does, has found a workaround. And that brings us to depolymerases.
Depolymerases. Okay, that sounds complicated. What are those exactly?
They're actually pretty simple. Think of them as specialized keys that some phages have evolved to break down Klebsiella's protective capsules.
Ah, so they unlock the armor and let the phage assassins in. I like it.
Exactly. Once the capsule is broken down, the bacteria are exposed and vulnerable to attack.
So it's like finding the right key to unlock the bacteria's defenses. But how do we find these depolymerases? It sounds like searching for a needle in a haystack.
You're not wrong. Traditional methods for finding depolymerases involve comparing protein sequences to see if they match known ones. But what if we're dealing with a brand new type? That's where the power of machine learning comes in.
Machine learning. So we're training computers to help us find these depolymerase keys.
You got it. And that brings us to DepoRanker, a new machine learning algorithm that's transforming the way we search for these crucial keys.
All right, DepoRanker. Tell me more. How does this work?
Imagine you have a tool that can look at a ton of protein sequences and tell you with incredible accuracy which ones are likely to be depolymerases. That's DepoRanker. It's been trained on tons of data and can spot subtle patterns that tell depolymerases apart from other proteins.
So instead of randomly testing proteins, researchers can use DepoRanker to tell them which ones are most likely to be the depolymerases they're looking for.
Yes, precisely.
I'm seeing where this is going, and I definitely want to dive deeper into this DepoRanker. But first, I need a little break.
Sounds good to me. Let's take a quick pause and we'll be back to talk more about DepoRanker and how it's revolutionizing the fight against antibiotic resistance. So where were we?
DepoRanker and its ability to identify potential depolymerases. Well, the team behind DepoRanker didn't stop there. They actually used it to analyze hundreds of Klebsiella phage proteomes.
Wow, so they basically used DepoRanker to create a library of potential depolymerase candidates.
Exactly. It's like having a treasure map pointing researchers to the most promising leads for new phage therapies.
So instead of blindly searching for new depolymerases, researchers can now use this DepoRanker-generated list to focus their efforts.
Precisely. It could really speed up the development of new treatments for Klebsiella infections, which is crucial considering the growing threat of antibiotic resistance. I was just going to say, this sounds like a major step forward in the race against these superbugs. We need all the help we can get.
Absolutely. The rise of antibiotic-resistant bacteria is a serious global health threat. We need all the tools we can get to combat this crisis.
And DepoRanker seems like it could be a powerful new weapon in this fight. But I think what's also really exciting is the collaborative aspect of this research.
You're right. By making DepoRanker freely available, the researchers have empowered the scientific community to join forces in this battle. It's a fantastic example of open science at its best.
It's really inspiring to see scientists coming together like this to tackle these complex challenges. Now let's shift gears for a moment and talk about what this means for our listeners.
If you're interested in the fight against antibiotic resistance, this research offers a real beacon of hope. It shows how cutting-edge technologies like machine learning are being used to drive scientific discovery and potentially save lives.
It's also a reminder that scientific progress thrives on collaboration and open access to information. When researchers share their tools and findings, we all benefit.
You said it. And for those who are interested in delving a bit deeper, I highly recommend checking out the DepoRanker web server. You can actually see the algorithm in action, browse the list of potential depolymerases, and even test your own protein sequences.
Wow, that sounds incredibly cool. I might have to give it a try myself. But before we get too lost in the technical details, I want to bring it back to the big picture for a second. What does DepoRanker's success tell us about the future of medicine?
I think DeepRanker is a great example of how machine learning is changing the face of healthcare. It has the potential to revolutionize drug discovery, personalize treatments, and even predict disease outbreaks. We're really just scratching the surface of what's possible.
It really is an exciting time to be following these advancements. But I think it's important to remember that DepoRanker, while powerful, isn't a magic bullet.
That's a good point. While DepoRanker can identify promising candidates, it doesn't replace the need for thorough lab testing to confirm their activity and safety.
So it's like having a high-tech detective providing leads, but scientists still need to do the field work to crack the case.
Precisely. DepoRanker accelerates the process of discovery, but it's still a team effort, combining the power of machine learning with the expertise of scientists.
And that teamwork, that's what really drives scientific progress, right? It's amazing to see how different fields like computer science and biology are coming together to solve these problems.
Absolutely. This research shows just what's possible when people from different backgrounds combine their knowledge and expertise.
It's like innovation often happens at the crossroads of disciplines.
Yeah.
But as cool as all this DepoRanker stuff is, we should probably bring it back to our listeners. What's the main takeaway here?
If you're worried about this whole antibiotic resistance thing, this research should give you some hope. It shows that scientists are coming up with new solutions and that we're not just like sitting ducks in this fight.
Yeah, it really highlights the potential of machine learning and AI in healthcare. Who knows what other breakthroughs are right around the corner?
The possibilities are really exciting, but even with all these advances, it's important to remember that technology is just one piece of the puzzle.
Right, it's not a cure-all.
Exactly. We need a much broader approach, one that includes using antibiotics responsibly, preventing infections in the first place, and, of course, continuing to invest in research.
Well said. We all have a part to play in fighting antibiotic resistance. But for now, I think we've covered a lot of ground on phage therapy and this DepoRanker. Hopefully, everyone listening enjoyed this little peek into the cutting edge of science.
It's been great exploring this with you. And remember, folks, the search for new solutions never stops, so stay curious, stay informed, and who knows, maybe you'll be part of the next big discovery.